ITLS Pretest Exam Questions. Control major external bleeding. Which of the following conditions is your first priority in management of a trauma patient? Hemorrhagic shock. Among the following, what is the most common cause of preventable trauma death in the injured adult patient? Apply a hemostatic agent and gain intravenous access given enough fluid to maintain peripheral pulses. A 34-year-old man has a gunshot wound to the right groin area. Arterial bleeding, which cannot be controlled with direct pressure, is coming from the wound. The patient appears confused, diaphoretic, and has weak peripheral pulses. What is the appropriate fluid resuscitation for this patient? Wrist, elbow, and fracture site. Proper immobilization of a forearm, radius and ulna. Fracture involves splinting which of the following? Proximal tibia. What site is the first choice for interosseous infusion? 2 hours. Tourniquet application should be limited to less than. Serum lactate levels, abdominal ultrasound. Which assessment tool, S, may assist in predicting patient deterioration for someone who otherwise appears stable? 5 minutes or less. A 24-year-old woman is found lying on the sidewalk after jumping from a 4th-story window. She is hypotensive, diaphoretic, tachycardic, and unconscious. Injuries include open skull fracture, pelvis fractures, and flail chest. What should be your goal for your time? Cyanide poisoning, high ambient light, carbon monoxide poisoning - all of the above, correct. Which of the following may affect the reliability of a pulse oximeter reading? Decompressed tension pneumothorax. Which one of the following should be performed, at the scene of a load and go, prior to moving the trauma patient to the ambulance? Presence of toxic fumes. In which of the following situations should an emergency rescue be used? Direct pressure to the wound. Hemostatic agents applied directly to the source of bleeding must be used in conjunction with, ventilated at a rate of 8 to 10 per minute. In the absence of herniation syndrome, adult head-injured patients should be. Hepatitis B. For which one of the following viruses is there currently an effective vaccine? Apply clean water to burned areas for up to 1 to 2 minutes. A 16-year-old girl is rescued from a burning house. She has 25% partial thickness burns, and the burned areas are hot to the touch. What is the appropriate treatment? Cardiac arrest. Which one of the following is a reason to interrupt the initial assessment? Pre-existing condition, anisocoria. A 35-year-old male is found at the scene of a motor vehicle collision. He is alert and oriented and complaining of knee pain. Your assessment reveals a respiratory rate of 16 per minute non-labored, pulse rate of 88 per minute strong, blood pressure 124/64, unequal pupils and swelling to the isolated knee injury. What is the most likely cause of the unequal pupils? Bilateral femur fractures. Which of the following injuries would change an otherwise stable trauma patient's category from stable to load and go? Relative hypovolemic, high space, shock. A 23-year-old female has won the "Let's see who can lean the farthest backward over the second-story balcony railing" contest. You arrive to find her boyfriend standing over her, holding 2 beers, as she lies on the grass under the balcony. She opens her eyes to voice, her skin is normal in color, respirations about 16 and unlabored, pulse 54 and a little weak at the wrist, with no external bleeding. She has flat neck veins, a normal chest and abdomen and a stable pelvis. First responders who arrive just before you tell you that her pulse ox reading is 94 and her BP is 74/30. If this is true, lung. Which of the following will generally suffer the least structural damage from a gunshot wound from a rifle, at the time of injury? The golden period begins. Intravenous fluid at a keep open rate. A 34-year-old man is injured in a motor vehicle collision. Physical examination is normal except for diffuse abdominal tenderness. He is conscious and vital signs obtained en route to the hospital are respirations 20 per minute, pulse rate is 120 per minute, blood pressure 100/60. How should this patient be managed in the field? Patients with dentures. Which one of the following may predict which patients might have difficult laryngoscopy and intubation? Secondary injury is caused by materials propelled. Which of the following concerning blast injury is true? Hypotension. In the elderly, which of the following findings is most likely caused by an acute injury? Hyperventilating to obtain an EtCO2 of less than 30. What treatment is not indicated in the routine management of the patient with a head injury? Massive hemothorax. An unrestrained 18-year-old male on the way to a post-graduation party leaves the road, bounces through a ditch and hits a tree. You find him behind the bent steering wheel, unconscious, cool, pale and clammy, with labored respirations of 30 and shallow, thready radial pulses of about 120, flat neck veins, trachea midline, an asymmetrical chest with absent breath sounds on the left. You assume he has a uterine obstruction of venous blood flow. Supine hypotension syndrome in the pregnant patient is caused by cardiogenic shock. A 23-year-old female has won the Let's See Who Can Lean the Farthest Backward Over the second-story balcony railing contest. You arrive to find her boyfriend standing over her, holding 2 beers, as she lies on the grass under the balcony. She opens her eyes to voice, her skin is cool, clammy and ashen, respirations are rapid and shallow, radial pulses are too rapid to count and thready. There is no external bleeding. She has flat neck veins, a normal chest and abdomen and pelvis. Her boyfriend tells you that she has some kind of heart problem but he doesn't know what. Placed on the monitor, she shows a wide complex tachycardia of about 280. What kind of shock is she suffering? Medial to the midline, avoiding the growth plate. Which of the following is the correct orientation for inserting an intraosseous needle to the proximal tibia? Cardiac contusion. A 54-year-old man is involved in a motor vehicle collision. The steering wheel is bent. During your initial assessment, you note his skin is pale and his radial pulses are present. Breath sounds are clear, heart tones are not muffled. Which one of the following is most consistent with these findings? Have the patient placed under protective custody, then treat and transport the patient using restraints if necessary. A 23-year-old man is injured in a motorcycle collision. The patient appears disoriented and grossly intoxicated. There is a large laceration on his scalp, which is actively bleeding. The patient refuses treatment and threatens to call his lawyer if anyone touches him. What should you do? Tension pneumothorax. An unrestrained 18-year-old male on the way to a post-graduation party leaves the road, bounces through a ditch and hits a tree. You find him behind the bent steering wheel, unconscious, cool, pale and clammy, blue around the lips with labored respirations of 30 and shallow, thready radial pulses of about 120, distended neck veins, tracheal deviation to the right, an asymmetrical chest with absent breath sounds on the left. You assume he has a posteriorly directed pressure applied to the cricoid cartilage. What is Selleck's maneuver? Inability to ventilate, achieve chest rise. Which of the following would be the most compelling reason to intubate a patient immediately? Directly over the top of the third rib, mid-clavicular line. Which of the following is an acceptable location to insert a needle when decompressing a tension pneumothorax? The radial pulse disappears upon inspiration. Pulsus paradoxus is best described by which of the following? Distance, impact area on the body, surface struck. What are the most important factors in determining injuries sustained in a fall? BP 170/100, pulse 50/min. Which of the following sets of vital signs is most compatible with a diagnosis of isolated head injury with increasing intracranial pressure? Narrowed pulse pressure. Which one of the following is typically associated with post-traumatic hemorrhage, early shock, spinal motion restriction? You have a patient with an isolated stab wound to the lateral chest. According to recent studies, which of the following procedures should be avoided? Cervical. Which area of the spine is most susceptible to injury in a rear impact motor vehicle crash? The fix-it process. During the primary survey, you recognize your patient is in need of immediate ventilator support. You delegate this intervention to a team member and you continue the primary survey. This delegation of interventions is called patients with non-dilated pupils. Which of the following has a greater chance of surviving traumatic cardiopulmonary arrest? Head. What is most commonly injured during a fall from a height of an infant? Volume replacement should be given earlier and in larger amounts to the pregnant, burn patient. Which of the following statements concerning treatment of shock in the pregnant, burn patient is true? Decreased pulse, warm and dry skin. Which of the following is most typical of early, neurogenic shock? Patient with abdominal tenderness, clammy skin, blood pressure 100/70, and pulse 130/min. Which of the following trauma situations would be considered load and go? Hypoxemia. What is the most common cause of cardiopulmonary arrest in the trauma patient? Resuscitative efforts should not be started and the patient pronounced dead. A 49-year-old man is involved in a motor vehicle collision. First responders are doing CPR. Findings include a distended abdomen and obviously deformed pelvis, and a quick look at the monitor shows AZ's toll. Which of the following is the most appropriate act?